I'm Colleen. This is my full comprehensive assessment of an adult, and this is my mom, JoJo. She's going to be my patient. Okay, so I'm going to start off. I'm just going to check out your head, okay?
Sure.
Have you been having any headaches recently?
Not recently.
No. Have you noticed any bald spots?
No.
No. So her hair growth is symmetric throughout. There's no balding, no lesions. Patient denies any headaches. Does it hurt at all as I press on your scalp here?
No.
No? Head's symmetrical, normocephalic. Fix your hair a little bit. I'm going to check out her skin now. So her face, there's no lesions, no masses, no bruising. No bruising onto her chest, her arms. Hold your arms out for me. She has a couple of freckles, but skin is pink, intact. Warm to the touch. You can put your arms down. Uncross your legs. Same thing on her legs. There's no masses, no edema, no swelling. Have you noticed any swelling recently in your legs?
No.
No? Okay. And I'm going to check for capillary refill. So I'm just squeezing her toes to check for capillary refill on both feet bilaterally. Capillary refill is less than 3 seconds. Now I'm just going to squeeze your fingers. And again, bilaterally, capillary refill is less than 3 seconds. Skin's intact and color's consistent throughout. There's no masses, no bleeding, no bruises. All right, so now what I'm going to do is I'm going to check out your eyes. Okay. Do you follow up with an eye doctor?
Yes, I do.
You do? Do you wear glasses?
I do for reading.
Okay. Do you wear contacts ever?
No, I do not.
No? Okay. And your glasses are strictly for reading?
Yes.
So you can see far away, just up close is...
Correct.
Okay. That's common with aging. All right, so what I'm going to do is I'm going to get the Snellen chart out. And do you remember this from the eye doctor, all the
Yes,
letters? Okay, so I'm going to hold it up here, and I want you to read the smallest line that you can. So can you read this one that my finger's pointing at?
DLCF.
Okay, perfect. Now I want you to cover your left eye with your hand, and I want you to try and read the line below it.
DHJBS.
Awesome. And now cover the other eye. And then read the line above it.
OLCP.
Good. And the one below it.
DHJBS.
Awesome. Perfect. So the patient has 20/30 vision in both eyes, which is good. Now what I'm going to do is take the pen light. I'm going to shut the light out for a minute, okay?
Okay.
So what I'm going to do is shine the light in your eyes on both sides.
Okay.
Okay? I guess they can see some. Just look straight ahead at the computer. Okay, good. While we have the lights out, I'm going to check for the internal eye, okay? So as I shine the light in her eyes, the pupils constrict bilaterally symmetric, as well as when the light is in the opposite eye pupil constricts as well, which is all normal findings. Now I'm going to shine this light in your eye. I want you to continue to stare straight. I'm going to get close to your face, and I'm going to look at your internal eye.
Okay.
Good. On the other side, make sure you're looking straight ahead for me.
Sure.
Again, bright light in your eye. Okay, good. I'm going to turn the light back on so you're going to watch your eyes.
Okay.
Okay. So as I shine the light in her eyes with the ophthalmoscope, I see the red reflex, and as I get closer, I see the ocular optic disc that's yellowish on both sides with sharp margins, all normal findings. There's no bleeding on the inside, no hematoma, no hemorrhaging, no lesions noted, no drusen bodies in the internal eye. Her sclera is white. I'm just going to pull down on your eye here. And her conjunctiva is pink and moist bilaterally. She has no lid lag. Okay, so now what I'm going to have you do is follow my finger.
Okay.
So you look at my finger here and just follow it just with your eyes and not your head. Good job. And as I'm doing this, I'm looking for lid lag. I'm looking for nystagmus, which she does not have any of. All normal findings. And convergence is normal. Now what I'm going to have you do is stare straight ahead, and I'm going to wiggle my fingers from behind your head like this.
Okay.
And I want you to tell me when you can see it in your peripheral vision.
Okay.
Okay?
Yes. Yes. Yes.
Okay, so her peripheral vision is intact on the left. Now I'm going to test the right, and this is the wiggle finger test. Tell me when.
When? When? When?
Okay, perfect. So her vision is intact. That was checking out her optic nerve for her cranial nerves, as well as ocular motor, abducens, and trochlear. So now what I'm going to do is I'm going to start checking out your ears, okay?
Sure.
So for her ears, we're going to check out the acoustic nerve, as well as take a look on the inside. Have you noticed any visual changes recently?
No.
Okay. How about hearing changes?
No.
Any ringing in your ears?
No.
Do you feel like you need people to keep repeating what they say in order for you to understand what they're saying?
No.
No? Okay, awesome. Have you ever had surgery to your ears?
No.
Okay, so I'm going to start off just by palpating the outside of your ear. So I'm just going to touch around, okay?
Sure.
Any pain as I touch around your ear here?
No.
Okay. Any pain on your tragus here?
No.
Okay. And what about behind it as I press on the bones?
No.
No pain down here?
No.
Okay, good. I'm going to do the same thing on this side. Just going to touch around. Her ears are symmetrical. There's no redness, no lesions noted on the outside, on the auricle or the tragus. Patient denies any tenderness. Any pain down here?
No.
And on your tragus here?
No.
No? Okay, cool. Now I'm going to check the inside of your ear, so I just want you to stare ahead.
Sure.
I'm going to pull back on your auricle here and just look inside. So there's a little bit of cerumen in the ear canal on the right side. The tympanic membrane is a pearly gray color, intact, no lesions or scarring noted. Okay, and as well on the left side, cerumen in the ear canal, tympanic membrane is a pearly gray. And the tympanic membrane is intact. So now I'm going to test out your hearing. So what I'm going to do is I'm going to have a seat behind you here, and I'm going to occlude the tragus on your right side,
Okay.
and I'm going to whisper a couple words, and I want you to repeat what I say.
Okay. 99. 45. 66.
Okay, perfect. So she repeated all of the words that I said accurately on the left side. So now I'm going to do the same thing on the right side. I'm going to whisper a couple words and I want you to repeat them.
Baseball. 45. 99.
Okay, awesome. So her acoustic nerve is intact, which is for hearing. I'm also going to take this tuning fork.
Okay.
What it's going to do is I'm going to tap it against myself and put it on top of your head.
Okay.
And I want you to tell me if you feel the vibration on both sides equally.
Okay.
Okay? So just stare ahead again. Put it right in the middle and tell me if you hear it equally.
Yes.
Okay, good. So now what I'm going to do, hit this again, it's going to vibrate. And what I'm going to do is I'm going to put it on the bone behind your ear.
Okay.
And I want you to tell me when you stop hearing it.
Okay. Stop.
And do you still hear it
Yes.
now? Let me know when you stop.
Stop.
Okay, so on the left side, the air conduction is greater than bone conduction, which is a normal finding. And these are the Weber and Renee tests. So I'm going to do the same thing on this side. I'll vibrate and put it onto your bone behind your ear.
Okay.
I want you to tell me when you stop hearing it.
Okay. Stop.
And tell me when you stop in the front.
Stop.
Okay, awesome. So again, on the right side, air conduction is greater than bone conduction, which is a normal finding. So she had normal Weber and Renee tests for the acoustic nerve. Now what I'm going to do is take a look at your nose and mouth. So I'm going to throw some gloves on. Have you had any difficulty swallowing?
No.
Any drainage from your
no.
nose? Okay. Any drainage from your nose?
No.
Have you been coughing recently?
No, I have not.
Belching more than normal?
No.
Okay. So first thing, I'm just going to take a look in your nose.
Okay.
Okay, so I just want you to stare straight ahead. I'm just
Okay.
going to look up. And the other side.
Tickle.
Sorry. Okay, good. Sorry. So inside her nose, it's intact, pink and moist. There's no bleeding noted, no lesions. Do you feel like you have any cuts up in your nose?
No.
Okay, and you've been able to breathe through your nose normally, no congestion.
Yes.
Okay, so what I'm going to do is I'm just going to occlude the left side, and I want you to take a breath through the other side. That feel normal?
Yeah.
And then the other
Stuffy.
side. Do you have allergies?
Yes.
What are your allergies?
Allergic to pollens and cats and
Any medications?
oh yes, I'm allergic to penicillin and aspirin.
Aspirin? And then do you have any seasonal allergies?
Just the pollens and
Okay.
ragweed.
Okay, I'm going to just palpate along your sinuses here. Any pain?
No.
Any pain under your eyes here?
No.
What about under here, under the jaw?
No.
Okay. So I'm going to test out the trigeminal nerve. So what I want you to do is protrude your jaw forward
Okay.
and bring it back. Try and move your jaw side to side. Any pain with that?
No.
Okay, and I want you to clench your jaw, and I'm going to feel right here. Okay, good job. Both sides are symmetric. She's able to move her jaw, which is testing the trigeminal nerve. Now I want you to scrunch up your face real tight. I want you to smile real big. Open your eyes. Raise your eyebrows real high. And puff out your cheeks like a blowfish. Good. So with all of her facial movements, it's symmetric on both sides. So her facial nerve is intact. Now I just want you to open up your mouth and go, ah. Good. Stop. And do it one more time. Okay. I want you to lift your tongue up above. And move it, stick it out and move it side to side. Okay, and you said you had no difficulty swallowing, nothing like that? Okay. I'm just going to take a look at your lips, so I'm just going to pull down here. So as I'm doing this, I'm testing out cranial nerves. Her mucosa in her mouth is pink, moist, and intact, as well as her tongue. Uvula rises when she says ah, and her tongue is midline. Her trachea is also midline as I'm examining her. Any pain down here in your neck?
No.
Okay. Patient denies any difficulty swallowing. Any pain along your collarbone here?
No.
Into the back of your neck, no pain?
No.
Alright. What about pain in the shoulders?
No.
Okay. What I want you to do is I'm going to come behind you and I want you to shrug your shoulders up against my resistance. So this is testing the spinal accessory cranial nerve. Good job. Did you have pain with that?
No.
Alright, now I want you to turn your head to the left with me pushing against it. Good job. Any pain with that?
No.
And now we're going to go to the other side. Good?
Good.
Alright, now I want you to pull your chin to the ceiling and then pull it down real low. And then rotate your neck side to side. Good.
Yeah.
So she has full range of motion in her shoulders and her neck. Now what I'm going to do is I'm going to listen to your lungs.
Okay.
Okay? Have you had any cough recently?
No, I have not.
Okay. Any shortness of breath?
No. Just on run upstairs. But
Running up the stairs? Is that normal for you?
yes.
Okay. Do you have a history of any lung disease?
No.
No? So I'm just going to place my stethoscope on the back here and listen to your lungs, okay?
Sure.
So you can just breathe your normal. Take a deep breath in and exhale. Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. I'm just going to take a look at your back and lift up your shirt. So the skin on her back is consistent with the rest of her body. There's no bruising. It's coming up behind you here. I want you to take a deep breath. Okay. Chest expansion is symmetric on both sides. Lung sounds are clear and equal bilaterally. Now what I'm going to do is percuss your lungs. So I'm going to stick my finger on your back, lay it flat like this, and just tap my own finger. Okay? I'm just listening for those sounds. So just breathe normal. So as I percuss all over all the lung fields, I hear resonance, which is a normal finding. Like I said, lungs are equal and clear bilaterally. The patient's not in respiratory distress. Her respirations are 16, all normal findings. Now what I'm going to have you do is say 99, but I'm just going to put my hands on your back and I just want you to say 99.
99. 99. 99. 99.
Okay, good job. So I'm checking for tactile fremitus. Now I'm going to listen to your heart. So do you mind just laying back for me?
Sure.
And just lay flat. Perfect. I'm just going to come on this side. Alright, so what I want you to do is just lay flat like this. I'm going to take a listen to your heart. So same thing as your lungs. I'm going to put my stethoscope on your chest and I'm just listening. You can breathe normal.
Okay.
Okay? And as I do this, I'm listening for the rate and rhythm of her heart, which are regular. Her heart rate is 68. Now what I'm going to do is I'm going to listen to your carotids.
Okay.
You just lay the way you are. And the sounds of the carotid are symmetric on both sides. Now I'm just going to feel. again, regular rate and rhythm. So now what I'm going to do is lift up your shirt a little bit and show your
Okay.
belly. So now I'm looking for an irregular aortic pulse, which I don't see. I'm not palpating, but I'm just feeling for the aortic pulse and inspecting the stomach. The color of the stomach skin is consistent with the rest of the body. There's no masses or bruising. I'm going to auscultate first before I palpate so that we don't skew the abdominal sounds. So I'm going to listen to your stomach now.
Sure.
Just going to stethoscope on all sides.
Okay.
All right. Okay, so bowel sounds are audible and normoactive in all 4 quadrants. So, have you had any chest pain recently?
No.
Ever feel like your heart is racing out your chest?
No.
No? Okay, good. Any abdominal pain?
No.
Okay. So, patient denies chest pain, denies feeling palpitations. She also denies abdominal pain. When was your last bowel movement?
Yesterday.
Yesterday. And when you urinate, do you feel any burning or frequency?
No.
Okay, no changes that way?
No.
What is your normal? Do you have a bowel movement every day?
No.
Okay. Have you had any diarrhea recently?
No.
Any nausea or vomiting?
No.
No? Okay, good. So what I'm going to do is I'm just going to start feeling your belly.
Sure.
So you're going to feel me press on it. You take a deep breath in and exhale. So as she exhales, I'm feeling for the liver, which has a smooth border. I'm going to palpate over here. Let me know if you have any pain with me pressing on you. Any pain over here?
No.
Any pain in the lower abdomen?
No.
No pain down here?
No.
Any pain in the middle here?
No.
Have you ever had a hernia before?
No.
Okay, good. Alright, so now I'm just going to percuss the same way. I'm going to have my hand
Sure.
here and tap my finger, okay?
Mm-hmm.
So for this, I'm going to test how the liver span is. So I'm going to go for the tympani of the gastric air. To the dullness of the liver. Okay, and the liver span is within normal limits. I'm going to try and palpate or percuss your spleen over here. The spleen was not palpable. And as I percuss, I only hear tympani from gastric air, so it's not going to be able to be percussed either. So as I percuss, all I hear is tympani from gastric air. I do hear dullness over the liver, which is normal. I heard gastric air over the spleen, which is also normal. The abdomen is not distended. The patient doesn't have any tenderness as I press around, and the belly is rounded. Patient denies any nausea, vomiting, or diarrhea as well. All right, so you can sit up for me. And what I'm going to do is just tap on your back and see
Sure.
if you have any pain. Any pain with that?
No.
All right, good. And that striking the back that way is to check for tenderness of the kidneys, and the patient denied tenderness. All right, so a couple more things that we have to do, okay?
Sure.
I'm going to check out your muscles and your neurovascular system,
Sure.
okay? So right now what I have is a Q-tip or a cotton ball, okay? So you feel how that feels nice and soft?
Yes.
Yeah? And then do you feel how this is more sharp?
Yes.
Okay. So what I want you to do is shut your eyes.
Okay.
And I want you to point to where I'm touching you and whether it's sharp or soft.
Okay.
Okay? So I'm going to do your whole body, your face down to your toes.
Okay.
Okay? Do you have any questions?
No.
All right, so shut your eyes for me.
Soft. Soft. Hard. Hard. Soft. Hard. Hard. Soft. Soft. Hard. Soft.
Okay, so she has accurate sensation in all of her extremities as well as her face, which is a neurovascular assessment. All right, so now what I want you to do is touch your thumbs to your fingertips and try and do it as rapidly as you can. Just all through the, try and go in order. Good job. And hold your arms out like this. Try and pull them up towards the sky. And try and press down on me as hard as you can. Good. Now I want you to put your arms like this and try and pull me closer. And now push me away. Awesome. Now what I want you to do real fast on your lap like this, just flip over. Perfect. Good job. Now can you rub your shin from your knee, or your heel from your shin, from your knee down your shin. So take your this heel to your knee and rub it down your shin.
Sure.
And back up. Good. And do the opposite. Okay, good. And now I want you to touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, and the other finger, other finger. Okay, so the finger to nose test, heel to shin, everything's intact. She has proper muscle movement as well as neurovascular. Okay, so now what I want you to do is press on my hands like you're pushing the gas pedal. And now I want you to pull your toes towards you. Good. And while I'm down here, you can relax your legs. I'm just going to feel your pulses. Her dorsalis pedis pulses have regular rate and rhythm. They're +2. Normal. They're not weak or thready, and they're not bounding. Good. Now I'm going to feel the pulse behind your leg. Same with the popliteal, bilaterally, +2 pulses. Now I'm going to feel your radial pulse right here. And so all pulses are palpable and +2. They're not weak or thready, and they're not bounding. Okay, now I'm going to take the reflex hammer, and what I'm going to do is hit you in a couple spots to check out your reflexes, okay?
Yep.
So what I want you to do is kind of relax your arm here. I want you to clench your jaw real tight. See, let go of the bed. Just let it relax. Relax. Clench your jaw. Good. Now I'm going to do the front here. Okay. So far, the brachioradialis and the tricep reflex are intact. Bicep as well. Good. Alright, now just let your feet dangle. I want you to push your hands together as hard as you can like that. Good. Okay, awesome. So all of her reflexes are +2 intact. I used some distracting techniques of her holding her hands together as I did her lower, and she clenched her jaw as I did her arm reflexes to make sure everything was intact. Okay. Do you ever feel like you have pain in your arms or legs?
No.
Do you ever feel like you're unsteady, you don't have a good balance?
No.
Okay. Do you have any complaints? Anything that is abnormal for you that's been happening recently?
No.
No? Do you know when your last menstrual cycle was?
Yes. February.
February?
Yes.
Okay, so you haven't gotten it for 2 months?
Yes.
Okay. Is that normal for you?
Now I believe I'm starting the change of life.
Starting the change of life? Okay, how do you feel about that?
A little excited.
Excited? That's good. Do you drink lots of water?
I try to.
You
I
try
can't
to?
say I do. I try to.
Okay, do you smoke?
No, I do not.
Okay, awesome. Do you drink alcohol?
Sociably.
Sociably? Okay, good. It's very important to not smoke, so I'm glad you don't smoke. All right, do you have any questions for me?
No.
No?
No.
Okay, cool. Thank you.
You're welcome. Thank you for the checkup.